So thank you everybody for being here today. Pretty excited about today. Sorry about the little bit of a late start, just getting all the technology working. But I am super excited. We have Shoji Shimizu today presenting for our lecture series. Shoji is one of our MICU fellows upstairs in the ICU, but he also comes to us with a wealth of knowledge about ultrasound. He's one of the ultrasound physicians from a previous life or from previous experience here. And so now he's bringing this to his training here at MetroHealth in the MICU. So he's decided that he wants to talk to us today about ultrasound artifacts. And I'm excited to have him present and share kind of his knowledge and what he wants to present to us today. So without taking more of his time, I'm going to turn it over to Shoji and take it away.
Thank you so much, Dr. Tabak. And then thank you for giving me this opportunity. And then this was a perfect opportunity for me to learn about artifact as well. So let's get started. So I have no disclosures. And then for objectives, so then to recognize various types of ultrasound artifact, and then to understand mechanism of each artifact, and also optimizing setting to reduce or minimize artifacts, and then apply those knowledge to aid diagnosis. Those are our objectives. And why it's important. So because we usually frequently encounter in daily practice, and also this sometimes confusing when we see artifact, is that true image or it's just artifact. So avoid misinterpretation. That's why it's important to understand how it looks like. And then also we can apply the knowledge to minimize and then improve image quality. And then it also can be used as clues to detect what's this tissue looks like or tissue composition, and then aid in diagnosis. And then for ultrasound, we usually seeing the image using the assumptions. Those assumptions includes usually sound beam is a single uniform beam, not multiple. And also the beam is negligible in terms of width or thickness. And the sound beam travels in a straight path, not reflection or not curvilinear way, just straight path. And the speed is also constant, usually 15-40 meters per second, and then it should be constant. And also echo returns after a single reflection, not multiple reflection. And then echoes originate from within main ultrasound wave. I will go over about this, but echo has 3 waves, and then 2 other minor ultrasound waves other than main waves. So, but the echo usually assume that the echoes originate from main wave. And then also the energy of the sound wave is uniformly attenuated. And then the depth is mainly related to time, not the actual distance. So those are the assumptions. And then when those assumptions not maintained, then we will see artifact. So artifact, there is 4 main categories I will go over, but usually sound waves, can you guys see my pointers? So usually they go from transducers, then has reflection, but sometimes we have refraction as well, and also sound waves attenuate as go through. And then sometimes we see some scattering, and also sometimes problematic when we have this kind of curvilinear reflectors here. So there's 4 main categories of artifacts. So one is related to wave propagation or multiple echoes. Those include reverberation artifact or Comet-tail artifact, ring-down artifact, or mirroring. Don't worry about the name of the artifact. It comes after when you see actual image. Second one related to velocity errors. Those include refraction and also speed displacement artifact. Third one related to beam characteristics, and then those include Lobe artifacts or beam width artifact. The last one related to wave attenuations. Those are kind of well-known artifact, acoustic shadowing or acoustic enhancement. I will go over each of artifacts with examples. So first category, wave propagation or multiple echoes. So this is examples from one of the articles, and then this is the echo over palpable left mass in neonates. And then you can see like high echoic area, and then that like repeating multiple times in a kind of evenly spaced manner. And then here is the next examples. Those images or movies are provided by Dr. Sharman. Thank you so much. And then this is the kind of like we frequently see when we do lung ultrasound. This is A line. You can see high echoic lines like multiple times in a evenly spaced manner. And then this is another figure with dotted line. So those are called reverberation. And then as you can see, the ultrasound waves reflect like multiple times and making those artifacts. So repeatedly reflected between like highly reflective interfaces cause this artifact. And then, as I mentioned, those are kind of typically seen A lines. To minimize these this artifact, you can just adjust angles or decrease the distance between the transducer and then the target. So, and then this is, I skipped the first one. So this is also lung ultrasound. You can see B lines. And then this is the image with like guide wire in the vessels. And you can see like multiple high echoic lines. So this is also type of reverberation artifact. And then this is another type of reverberation artifact called Comet-tail artifact. This is liver, and then this is gallbladder. And then you can see acoustic shadow. I will go over this artifact later, but at this point, I'm focusing on this one. So you can see high echoic signals here, but you also see that kind of tail, tapered tail. So this is called Comet-tail artifact. So as I mentioned, this is a form of reverberation, and then stacking of closely spaced reverberations, creating this tapering Comet-tail. And then this image is actually reflecting cholesterol crystal in Rokitansky-Aschoff sinuses, and then which is diagnostic of adenomyomatosis. This is also another example that ultrasound can help the diagnosis. So this is another artifact, but a similar categories. And then this is liver, this is gallbladder. So this should be duodenum. And then we can see high echoic signals here and then has bright line. It looks like Comet-tail, but which actually called ring-down artifact that was made by air and also fluid in the duodenum. This is another example. So this is the image that when trying to get the central line, but we can see these high echoic materials, but it's a common goal in the vessels. This is actually air bubbles in vessels coming from IV. So there was a bubble in the IV and then came from peripheral IV to this central venous system. This is also the artifact caused by air bubbles. So as I mentioned, that artifact called ring-down artifact, and then a high echoic signals here, and then has some tail or bright line beneath it. And then that is made due to like vibrations from pocket of fluid. So this is fluid, and then this is like bubbles, and then that vibrations cause like continuous source of like sound energy go back to transducers and then noticed as being down artifact. This is useful when we identify abnormal foci of air in abscesses or portal venous gas or some emphysematous cholecystitis or emphysematous pyelonephritis. So sometimes it's important to distinguish those similar artifacts, Comet-tail or ring-down artifact. So Comet-tail artifact usually made by foreign body or calcium or metals, like hard stuff. On the other hand, ring-down artifact caused by air. So we can distinguish by utilizing tissue harmonic imaging or spatial compounding imaging. So tissue harmonic imaging improves visualization of Comet-tail and then make sure turn it on to enhance Comet-tail artifact. And then spatial compounding imaging reduces like both ring down and also Comet-tail artifact. So make sure turn it off to enhance both. So utilizing those technique, we can distinguish those artifacts. Those are kind of similar artifacts, so sometimes we need to distinguish. So this is also another type of artifact in the same category. This is liver, and then we can see some like similar stuff here as if it is a kind of mirror. You can see these veins, and then this is also identical structures. This is the same liver, diaphragm, see high echoic images here, and then we can see similar structures on the other side. This is cool image. This is echocardiography. You can see like this, like as if additional chambers. So those artifacts called mirroring. So it's literally mirroring, and then ultrasound waves go this way, but the ultrasound wave also like going this way, but the transducer detect as if that signal coming from this. So that's why this artifact made. So sometimes diaphragm, pericardium, aorta, or bladder or bowel can be a kind of strong reflector, like a mirror. You can reduce this artifact by changing angle or decreasing gain. And then this is clinically important. Mirroring of the liver or spleen across the diaphragm should be differentiated from lower lobe consolidation. It's important to distinguish the difference between hepatization or like lower lobe consolidation from actual liver. So you can change the angle or just sliding towards head and then directly visualize lower lobe. So you can distinguish those, but it's important, don't be fooled. So then I'm going to next artifact, which is related to velocity errors. Those include refraction and also speed displacement artifact. So here, this is liver, and then this is gallbladder. And then we can see this dark straight line here. So this is gallbladder. So is that due to artifact or is that due to acoustic shadowing? It's important to distinguish. This is also another cool example from Journal of American Society of Echocardiography. This is actual aortic valve, but we can see additional aortic valve here. So this was caused by refraction. The ultrasound wave had refraction here, making this additional image. So this is a false image generated by refraction. This is true image. So refraction caused because the ultrasound wave has refraction when it goes through like different media and then causing like this dark shadows here, which called edge shadow or edge artifact. And then, so this is actually edge artifact. So it appears as vertical, like dark line or vertical shadows along the curved surface, like especially like gallbladder. And you can minimize by changing the angle, or then you can like distinguish that artifact from acoustic shadowing due to like cholecystitis or stones. So refraction is caused by the fact that ultrasound velocity different in like tissue by tissue. And then, so here is a kind of like examples of velocities. So fastest in bone and then slowest in air. So in general, the velocity is like slower in gas and then liquid and then solid. This is fastest. So that will like make that refraction. And then this is a kind of like high school physics, Snell's law. And then here is another example in same category. And then this is liver. And then we can see diaphragm here. And then, but we can see some small gap. This is a magnified image. We see this gap. This is more evident image. We see some high echoic mass here. And then we see liver and we see diaphragm here, but there is obvious gap. And then that was explained because the velocity in the liver is different the velocity in the mass. So there is a difference in velocities. And then it will take time for ultrasound wave to go back to transducers. Then that signals interpreted as like actual difference. So that's why this gap caused. As I mentioned, the ultrasound wave go this pathway takes longer time, then that is processed as like distant structures. So that's why there's a gap. So sound beam travels differently in focal area than surrounding tissues. Then we see this artifact. The longer the round trip is, the deeper on the image we see. So this is cool examples. This is echocardiography image. We see left ventricle and then right side, but we see like additional chambers here. It looks like LV, but it's a kind of like different and then spaced in this direction. This is actually the combination of artifact. This is kind of like mirroring. And then the pericardium causing this mirroring. But on the other hand, that also the artifact related to velocities, errors. That's why it like the image is distorted. So then I go to third categories, the artifact related to beam characteristics. And then that includes lobe artifacts or beam width artifact. I mentioned in the introduction that the ultrasound waves has 3 different beams. One is main beam. This is a kind of like 3 dimensional like bow tie shaped beam. And then the other like minor beam includes grating lobe signal and also side lobe beam. So 2 additional off-axis low energy beams. So those 3 beams are kind of like main ultrasound beam, but mainly the image is made by this main beam, not from those. So this image is actually from TEE. This is written in Otto's echocardiography textbooks. We see high echoic materials on aortic valve. It looks like vegetation or some mass in here, but this is actually beam width artifact, and which actually reflecting non-coronary cath of aortic valve emphase. So beam width artifact made by this, as I mentioned, this echo image is made mostly by this main beam, but it like widened distal to focal zone. This is a focal zone. It goes like widened after this focal zone. When we have like structure here, then it was perceived as if that signal coming from this main beam, narrow main beam. So signal distal to focal zone could be falsely recognized as like the beam originated from within the narrow imaging plane. So to adjust this, you can bring this main target to focal zone like this. Then we can eliminate this artifact. So best minimized by adjusting the depth of the focal zone to the target structure. This is another example. This is gallbladder. We can see high echoic lines here. This is example of side lobe artifact in gallbladder. So then this is a kind of artifact of the side lobe beam, like reflected by this echogenic wall. that make this artifact. And then this is also another examples. We can see these high echoic lines not explained by like anatomy. So this is example of side lobe artifact as well. So lobe artifact, as I mentioned, there is three ultrasound beam, main beam, side lobe, and then grating lobe. If we have some structure here, and then the signal is strong enough, then ultrasound machine recognize that signal coming from this actual imaging plane. Usually side lobes like consist of like only 1% of ultrasound energy, so typically not making any images. But do so when a strong reflector is in the path of the lobe beam, and then strong enough to make the imaging. Usually seen in near field of anechoic structures with curved walls, such as a gallbladder or bladder or heart. Then I go over the last categories, artifact related to wave attenuations. Those are kind of like familiar artifacts. You can see liver, you can see gallbladder, and then seeing some cholecystitis, small cholecystitis, having low echoic area, like a shadow. This is also frequently seen images when you do lung ultrasound. Deep shadow here, bright line in front, and then shadow beneath it. So acoustic shadowing, it's like easy to understand. The ultrasound wave reflected here, and then making the shadow beneath it. So seeing deep to any highly attenuating structure such as stones, bones, foreign bodies, or air. And then when we have like hard stuff like stones, bones, like metals, then we see green shadows. But when we have air, then we have like dirty shadows. That makes like abdominal ultrasound is difficult for us. It's dirty shadow from air. This is bladder, urinary bladder, and then we see this high echoic area beneath the bladder. This is liver, and then we see like this high echoic area here. So, you can see liver, and then pleural fluid, and then this is lungs, and then this is a kind of acoustic shadow made by vertebral bones. But here you can see high echoic area, which is made by this artifact. It's the opposite of acoustic shadowing, which is called acoustic enhancement. So acoustic enhancement. So this artifact occurs like deep to any fluid field structures. And then that can be minimized by reducing far field gain. Then you can improve the quality of the image. So this is not artifact, but when you do ultrasound here, this area is hard to see. Then you have chance to miss something, included this area. To improve the quality of the image, then we can see this. Like we can see like the actual texture of the liver. It's better in this image than this. This is kind of like difference in terms of like attenuations. So this is a well-known graph. When we increase the frequency, then we have like better resolutions. But at the same time, penetration is poor. It's a kind of trade-off. Usually, linear probe or vascular probe have like up to 15 megahertz. On the other hand, abdominal or sector probe or cardiac probe has like 1 or 2 to 5. So when we see deeper structure, we usually use abdominal or convex or sector or cardiac probe to see deeper structure. Sector probe has lowest frequency, like down to 1. So you can choose probe appropriately depending on what you are seeing. But this concept is important. It's a trade-off relationship between resolution as well and also penetration. So it's pretty important to evaluate with at least 2 planes. If it's artifact, then most likely will disappear. So I will quickly review those like main artifacts and then go to summary and then finish. So as I mentioned, ultrasound artifact divided by 4 main categories. First one, wave propagation or multiple echoes. And then second category is velocity errors. And then third one is beam characteristics. And the last one is wave attenuations. So the first one, wave propagation or multiple echoes. This artifact includes reverberation, like A lines, like multiple evenly spaced high echoic lines. And then 2 similar artifacts, Comet-tail artifact and ring-down artifact. Comet-tail artifact usually made by hard stuff like bone or calcium or foreign bodies. On the other hand, ring-down artifact is made by air in the or like fluid in the pocket. It's useful to detect air in the tissues like emphysematous cholecystitis or air in the duodenum. And then also mirroring, it's a kind of like reflectors like diaphragm, pericardium, making like identical image on the other hand. So the second one is velocity errors. I went over refractions. The sound waves has refraction when it goes through like different media or different tissues, and then causing like edge shadows. And also ultrasound takes more time or different time when it goes through like different tissues. And then when it takes more time, then the ultrasound recognize it coming from deeper tissues and then making this gap, this called speed displacement artifact. And then the third one is related to beam characteristics and then lobe artifact. So there was 3 main ultrasound beam, main beam, side lobe, grating lobe. And then the signals coming from side lobe, if it's strong enough, then ultrasound recognize that signal coming from main beam. Then we see this lobe artifact, side lobe artifact. And also we see beam width artifact. The ultrasound wave is going like this bow tie shape. We should bring this target to the focal zone to adjust this image. And then the last one is related to wave attenuations. So acoustic shadowing or acoustic enhancement included in these categories. So summary. So artifacts arise from those four categories: wave propagation or multiple echoes, or velocity errors, or beam characteristics, or wave attenuations. And then this artifact can be clue to tissue composition, and then sometimes help diagnosis. And then always remember to evaluate with at least 2 planes. If it artifact, then it will go away, and then don't be fooled. And then artifact can be minimized by changing angle or gain or depth of focal zone, or just changing the location of the scanning, or sometimes utilizing tissue harmonic imaging or space compounding imaging. So that's all. This is the differences I used. And then most textbooks cited like these articles, and this is really great review articles. And this is as well from radiographics. And then I used Otto's textbook of clinical echocardiography. This textbook is perfect when you considering applying for critical care echocardiography. And then also I use these textbooks written by Dr. Sony, point of care ultrasound. This is really great, concise textbook. Go over like everything related to focus. Thank you so much for giving me these opportunities. Any questions?
Thank you, Shoji. We'll open it up to questions. If you want to ask questions by unmuting and asking, or if you want to put it on the chat, I can read it out. More than a question, I have I have a comment more than a question, which is well, not all artifacts are bad. Of course, you know that you use reverberation artifacts to talk about B lines, and you use shadowing artifact to make your stones more, or you depend on shadowing artifacts to make your stones more visible and recognizable. And also some software machines use some software to enhance artifacts, reverberation artifacts in particular, when they make the needle more apparent. When you're trying to do a line, there's a button that does needle enhancement and stuff like that. While some other artifacts that are bad, such as the side lobe artifacts, where the answer is usually not to increase the gain. I'm guilty of scanning in a brightly lit room and increasing the gain up to the maximum, which tends to enhance or increase the effects of mirroring, and also the effect of side lobe and grating lobe artifacts. So if something doesn't look right, the answer is probably not to increase the gain, but rather to dim the room and decrease the gain. Of course, machine processing and software proprietary algorithms can actually change the way the picture looks, and might inadvertently cause an artifact to show up more than you would like it to. So mainly scanning folks who have a lot of adipose tissue, or when you're looking at deeper structures, you might be stuck, and you have to use a lot of depth and increase the gain in the far field. But Shoji, you mentioned lower frequency ultrasounds are going to give you better penetration, and we've used this in, for example, in doing central lines on very heavy patients, rather than using the linear probe with high frequency, going to an abdominal probe, curvilinear probe with a lower frequency, just to be able to see the structures without much distortion. Again, if anybody has any questions, it's time to ask, and we'll wait for a second. All right, looks like all is good for now. Again, thank you, Shoji, for presenting, and thanks everybody for being in attendance. This video will be posted online. Dr. Tabit will do some work to put it up on the YouTube channel. Check it out. Check out the other videos there, and subscribe and share the word. Thank you, everybody.
Thank you so much, everyone. Have a good day.